Well, good afternoon and welcome to our DMAC Ask a Professional event. Thank you all for tuning in today. We are excited to have Dr. Tim Mack, a physical therapist, here with us today. And our hope really with these events are that they're linking your education and maybe your career interests to professionals that actually work in those careers right here in Central Iowa. So again, thank you all for tuning in today. Before we get started, I would just like to say a quick hello as your host. My name is Jill Hoyk. I work a part of the work-based learning team here at DMAC. And so if you all have any questions for Dr. Mack throughout today, we would love to hear from you. And if you would kindly leave those in the chat, I can get those over to him too as well. But without further ado, Dr. Tim Mack, I would love to start to kind of get to know your career journey and all of that. But first and foremost, thank you for being here with us today. Dr. Mack serves as a physical therapist at Waukee Outpatient Physical Therapy for Unity Point Health. And so with Waukee in the name, it's in Waukee. But as we were talking about earlier, there's a lot of physical therapy Unity Point clinics around too as well. But Dr. Mack, can you kind of give us a little bit of your background? What made you interested in physical therapy? Is it something you knew all along, or is it something you became interested in maybe while you're in college, and kind of your educational background too as well? We would love to get to know you.
Sure, thank you, and thanks for having me. Yeah, I grew up in Boone, Iowa. Technically, my parents lived in Ogden, but we open enrolled, so we did everything kind of in Boone. I grew up there, and I knew I wanted to do PT from a pretty early age, which I wouldn't say is typical because my dad's actually a physical therapist as well, so I followed in his footsteps. He's still a PT up at Boone County Hospital, actually, so it's kind of a neat little connection that we have that we get to talk about pretty often. So I grew up around it. I always thought I looked up to my dad a lot, and he seemed like this kind of pillar of the Boone community. He kind of knew everybody, and everywhere we'd go, he'd be talking to people or saying hi. So I thought that was really cool. And, as a kid, I was one of 5 kids, so we would go into his office, and when patients weren't there, we got to play on the equipment and stuff like that. So it was pretty neat. So I knew I wanted to do it for a while. So in high school, that was kind of the plan. So I went to Boone High School, and then from there, I went to UNI up in Cedar Falls for my undergraduate degree. I started as a biology major, and because basically what you're trying to do, if you think you're going to go into PT, you just have to meet the prerequisite courses to apply for physical therapy school. So you can do different majors at a 4-year degree level to then apply to go on to graduate school. So I started as biology, and then it was pretty heavy in chemistry, which I wasn't super fond of. So I ended up switching to movement and exercise science, which was good. And then actually about my sophomore year, I kind of hesitated if PT was going to be for me or not. So I switched my major actually to management information systems, MIS, which is kind of a business technology degree, and tried to get into that a little bit, and then didn't like that. So I switched right back to movement and exercise science. So I kind of gave that a shot and realized, no, I think PT is for me. So I graduated from UNI, and then I applied to all the physical therapy schools in Iowa, and hoping to get into Iowa, and I did, luckily. So then I went on to the University of Iowa for 3 more years, and then graduated from there in 2017, and then I've been working as a PT since. So yeah.
And then are all physical therapists, do they all have a doctorate degree, or is there other kind of pathways for that too?
Sure. Yeah, that's a good question. Now, if you're going to PT, you will automatically have a doctoral degree just because all the programs have transitioned to the DPT. My dad, it's fine, he does not have a doctoral degree. He has a master's. So it used to be a master's program. And I couldn't tell you exactly what year they transitioned, but probably the last 10 or so, maybe more years, they transitioned the master's program to all doctor programs. So, yeah.
Gotcha. Gotcha. Yeah, I had read something about that, so I wanted to get some
For
clarification.
sure. Yeah. Yeah.
Since you kind of knew, in high school that this is potentially a pathway that you wanted to go,
Yeah.
and for those students that are logging in right now, is there any classes that you recommend maybe that they could be taking in high
Sure.
school that would benefit them or that you felt like that benefited you?
Yeah, totally. Anatomy would be the number one that I would recommend. Human anatomy. By far, it's our biggest tool as a physical therapist. That's what we're kind of basing all of our information off of when a patient comes in, is they kind of tell us where things are hurting or where they've had an injury. So having a very good foundation of anatomy is important. And then, you will also get into, especially in school, stuff like biomechanics and physics. So you'll have to take those type of things in college because those are some of the prerequisites we talked about to apply to physical therapy. So, it wouldn't be a bad idea to have a good understanding of those to make your transition to the college class a little bit easier. But I'd say the main one would be anatomy for sure.
And Dr. Mack, you work more in a clinical setting. So can you kind of explain maybe the type of patients that you see? Like, are they coming off of maybe like ACL injuries? And then maybe some other realms. I guess maybe my question is there different specialties that PTs can go into? Like, because I know obviously there's some in the hospital setting and
Right.
in the clinical setting, and kind of
Right.
what's the difference? And maybe just what at like day to day, what your day looks like.
Sure. Yeah. Yes. And that's the cool thing about physical therapy is, you know, we all come out of school as kind of a generalist. So your education, they make sure that you get an education that covers all aspects of where you would potentially, land a job in. And then once you find that job, that's kind of where you kind of specialize, I would say. I work in the outpatient setting. So a lot of the patients I see are, yes, you could say like ACL, more sports injuries, but we see a lot of different, knees, shoulders, hips, but mostly people who are going to be able to walk in off the street to get to their therapy. They'll go to their doctor, complain of ache or pain. If the doctor thinks that therapy will help, we'll get a referral and see them. So, I see a lot of back pain, a lot of shoulder pain, a lot of knee pain, and then some sports injuries too. Other settings, like you mentioned, hospital. So like an inpatient setting, like a transition where you'd be working with multiple PTs. If you have a total knee replacements, which is pretty common when you get a little older, potentially if you're having a lot of knee pain, they'll do a total knee replacement. An inpatient therapist would work with you right after the surgery for maybe a day or two to try to get you walking, get your knee moving, teach you a few exercises. And then when you're discharged from the hospital, then you would come see me in an outpatient setting where we would then work on more functional things like walking, getting your knee stronger, making sure you can go up and down steps okay, all that kind of daily stuff. So those would be inpatient, outpatient settings. And then, we'll have clinics where people more specialize in like neurologic conditions. So I'm more outpatient orthopedics, so more working with aches and pains, joints, whereas like a neurologic therapist is going to work on people maybe who've had a stroke or some sort of neurologic condition that they need specialized training for. And then there's pediatrics too, where you're going to be working with kids, which some people like more, working with younger kids, so you can specialize in pediatrics. A lot of different areas, which is kind of neat because if you do come out of school and you get your degree and you get a job and you're like, I don't know if this is for me, you can really change settings and really change what you're doing day to day, which is kind of nice.
Yeah, that is really cool.
Yeah.
What traits do you feel like students, should have if they're thinking about going into this career pathway?
Sure. Yeah. You're dealing with people all day and you're dealing with people who may not be in the best mood because they might be hurting or in pain. You come from all different backgrounds, which is probably the most interesting part of the job, is getting to meet people from all different backgrounds. But just being a good listener is really important, because sometimes people feel like they just haven't been listened to in regards to their pain. Being empathetic and being able to really connect with somebody and make sure they're heard and that you understand their pain, and you kind of feel that making that connection can be really important. So being able to show some empathy, being a critical thinker is really important, because you go to school and you learn stuff in a textbook and you take tests on that and it's straightforward. Well, when you get out into the clinic after those first few years, sometimes you feel like you got to keep your floaties on from drowning. Sometimes it's not exactly what you think. So you always got to be thinking, and in therapy, it truly is, we kind of test things, see how they go. And then as the patient comes back next time, you kind of check in. So you're coming up with hypotheses all the time to like, oh, we're going to try to treat this. They come back, if they might come back and say, hey, that's great, then we kind of know what we're working with. If they come back and say, hey, I'm in more pain, or that didn't seem to help, then you kind of have to always be asking more questions and thinking kind of outside the box to make sure that you're on the right track.
Yeah, and absolutely. I think you would agree that even sometimes one treatment that works for one patient doesn't work for the next. So every injury is different. So it's definitely a customized treatment process for each.
For sure.
So, and like you mentioned, being a good listener, and yeah, you're telling them to do things that hurt. So yep. I'm sure that you're not always their favorite person sometimes too as well.
Correct. Yeah. Yep.
Absolutely. So how many hours do you typically work in a week?
Sure.
And does that vary, or since you're in more of a clinical setting, is it pretty set?
Sure. For me in this setting, it's fairly set. Now I work a standard 40-hour week. My days vary. On Monday and Wednesdays, I'm in the clinic from about 7:45 until about 4:15, 4:30-ish. Tuesday, Thursdays are my later day. So I work from about 8:45 to 6. And in therapy, we're seeing that more. We're trying to catch people, when they just get off work, or, when you're in a business where your commodity or your product is people. Well, if they're at work, sometimes it's hard for people to get there. So our hours are expanded a little bit to, work until 6 o'clock isn't everybody's favorite thing to do, but to kind of catch those people and make sure we're helping them and they can get in here, sometimes we have to work a little bit later or come in a little bit early. But that depends, company to company. Some companies might just still do the standard 8 to 4. A previous company I worked at, we worked till 7 on Tuesday and Thursday. So it just kind of depends on what company you work for. And you can, depending, the Unity Point, if I wanted to get a patient in over my lunch or stay a little bit late to get a patient in, I'm welcome to do that, and spend a little extra time. I would say I used to do that more, but I've got a 16-month-old son now, so I have to usually get him from daycare or get home to him some way or another. But yeah, most physical therapy, you're going to be a standard 40-hour week. In the inpatient setting, like at a hospital, that might vary a little bit depending on if the hospital's slow or busy, or if you get, sometimes when you're going around in the inpatient setting, you're trying to get to these people on different times. Well, if there's surgeons in talking to them or a doctor's in talking to them, well, that treatment might have to wait until later in the day. So your schedule's kind of all over the place. So yeah.
Absolutely. And what would you say is the toughest thing about your job or challenges that you face?
Sure. Yeah, I think for me, it's realizing that you can't help everyone. Sometimes in conservative treatment and in anything, you want to try to help everybody as best you can. And when you're really you've really exhausted everything and you've done your critical thinking and they're still not getting better. That can wear on you a little bit. I try not to take it personally, but you want everybody that comes in to hopefully get something out of coming in here. But I think it can be tough if a patient's not getting better, because you can take it personally, like, am I doing something wrong, or do I need to, and that's where it's good to have coworkers and to be in a place where you're willing to ask questions and willing to seek help if you're not making progress with a patient. But I'd say if probably the toughest part, or the part I don't like the most, is if I'm not making progress with somebody, which hopefully isn't happening very often. So yeah.
Yeah. Where do you see PT in 5-10 years, or anything new on the horizon that you can kind of see?
Yeah, I think technology is kind of getting crazy. So, with the pandemic, one thing that did kind of accelerate PT some was more of like telehealth, kind of what we're doing right here. Some companies, actually, insurance companies started approving where, people didn't feel safe coming in, or people couldn't get in the clinic if the clinic was closed or whatever. Some companies went to doing telehealth, so you could be potentially a physical therapist that you worked over a computer. Again, you wouldn't think the profession that would be very, I didn't like it when I had to do it, just because, a lot of what we do is physical, but you can do a lot of education and teaching over the computer. So that could be something I could see as being more common in the future, as if somebody couldn't get in, then if they're stuck at home or whatever, if to still get that session in, maybe we did a telehealth session instead that day. As far as other things on the horizon, dry needling is something that's been around for quite some time, but it's relatively new into the physical therapy profession. It's becoming much more popular. It's something that I got certified in last year. And if you don't know what dry needling is, it's kind of, most people know what acupuncture is, but it's an acupuncture needle just implemented differently. We're taking a small thin needle, and in areas of restriction called a trigger point, we're placing that needle to try to get it to relax. So that's something pretty neat that we've been able to implement. But yeah, just, physical therapy is good because a lot of our therapists, we do a lot of research, which I think is just just the foundation of where professions have to go. We need research-based and evidence-based practices to show that what we're doing is effective. So yeah, I think the future of physical therapy is good. And, we're definitely going to need more and more as baby boomers. Everybody's starting to get up there in age and are going to need physical therapy in the future. So, and technology eventually, I don't know about 5-10 years, but in the future, I think technology will be a big part of that. It already kind of is. Some areas will use video games for, like the Wii or different things developed to get people moving in different fun ways to potentially get physical activity in.
Well, yeah, and even like those STEM treatments and all of that,
Yes.
like, who knows
Yes.
how that's going to evolve too, right?
Correct.
Um,
Yep.
and I know this is, I just like to mention too for students, so physical therapy assistants, do you have any that work in your facility?
At this facility, we do not. Unity
Okay.
Point does employ PTAs, but there's not a PTA on site here full time. No.
Okay.
Yeah.
I just like to kind of mention the difference between the two.
Sure.
And have you ever worked with physical therapy assistants or kind of
Yes.
know that kind of the difference between the two? I just like to mention that because the education is quite significantly different and
Yep.
the roles are significantly different. Can you speak a little bit to that?
Yeah, for sure. Yeah. So a physical therapy assistant can basically do everything I do, but they can't do evaluations. So when a patient comes in, a doctor's referred them, or if they come in off the street, if you have the right insurance, Iowa is a direct access state. So that means, like Blue Cross Blue Shield, United, private health insurances, you can come directly to a PT. And basically, when you're coming off the street, your first visit is going to be an evaluation. So that's we're going to talk to you, figure out what's going on, go through an objective examination, test your strength, your range of motion, different stuff like that, and kind of see if it's something that we can help with. And then we kind of build a plan from that. In a PTA, they don't do that evaluation portion. They would take the plan that a PT establishes, and then they would then potentially take the patient after the evaluation for subsequent visits and take my plan that I've created and then run with it. I've worked with amazing PTAs in the past at a previous company that, I don't think of it, some might think, oh, PTAs here and our PTs here, PTAs down here, and that's not the case. It's a really, a good PT and PTA work together, are in close communication, go and check on the patients together if they have time. But for a PTA, you're just going to be doing daily treatments under the supervision of a physical therapist. But they're very good PTAs out there that when you're a new PT, sometimes I'm learning from PTAs who've been in the business for 20 years, whatever. So they do a really good job.
Awesome. Thank you for speaking on that.
You bet.
So a lot of times with healthcare professions, especially the ones who are doing a lot of the evaluating piece of that, it comes with paperwork or charting.
Sure.
How much of that takes up your day? And
Sure.
Is that cumbersome, or what are your kind of thoughts on that?
Sure. Yeah.
Necessary. It's very necessary.
Yes. 100%. I want to change my answer earlier for the hardest thing about my job. I'm going to say the paper now, but it's probably my least favorite part of the job because the people are definitely my favorite part. But paperwork is necessary, and it's needed to show that, what you're doing to insurance companies for them to then, be able to pay for those services provided. So it is necessary. How much time do I spend? It depends. Evaluations definitely take longer. Those are probably going to take, 5 to 10 minutes to complete, depending on, we have kind of point of service now where we take a laptop in with us. Most PTs do, some don't, where they'll just kind of handwrite notes and then they'll do the note afterwards. Well, that gets kind of difficult sometimes if you're not doing documentation throughout the day as you're seeing patients, because then you just get way backlogged. And then at the end of the day, if you're trying to get 7 notes done, sometimes that's a little bit of a drain. So, I'd say I probably spend 10 to 15% of my day doing my documentation. For others, they might spend more than that. Some people are more detailed with their notes. Some people are less. But daily notes usually go by really fast. The evaluations are what take the time. And it is important to make sure, that you're documenting things accurately and you're getting the important information in there, because most people have a great experience and everything, usually goes just fine 99.9% of the time. Some instances, say, in a professional setting, sometimes work comp related stuff. Well, if something, say a patient sues or something, they feel like they were wronged, or in a work comp case, if a patient sues their employer and they were being treated by you, you could be called to be deposed in a trial. And, that might be 3-4 years from when you saw them. So, you have to rely on your documentation, and I'm not going to remember what I wrote 3 or 4 years ago. So you better have taken a pretty decent note to make sure that it was somewhat accurate.
Absolutely.
Yeah.
Well, I want to be respectful of your time, so I have a couple more questions. So for those of you on the call, if you have any, please leave them in the chat now. But Dr. Mack, if you could start all over again, would you change your career path in any way, or are you really proud of how you did everything?
Sure. Yeah. No, I think my answer might be different if I didn't switch my major in school. That was kind of my chance to see if I wanted to do something else. And, I don't think so. I really enjoy what I do. And, I started here with Unity Point in October, and I just really like working here. I think they're a great company, and, I get a lot of time with my patients, and it's been a really good a change for me. So No, I really wouldn't change anything. I was lucky enough to know that it's what I wanted to do early on. So I was able to kind of prep for it. And if you don't think it's what you want to do right away, and all of a sudden you're a senior at your college and you're like, oh my gosh, I want to go to PT. It's one of those things where you can still get it done, but it does help to definitely prep for it. And on that note, I just wanted to say, one of the biggest things that helped me at UNI is I joined the pre-physical therapy club, and there'll be all sorts of clubs in college to join that you can have any interest in, and I highly recommend doing so. But the pre-physical therapy club, they really set everything out because there's certain deadlines you have to meet when you're applying. There's certain things you need to get done when you're applying, and they really helped lay all that out. And most colleges who would likely have a pre-PT club at them. So yeah.
Well, that perfectly goes into the question that someone asked in the chat.
Yeah.
Is it difficult to get into PT school?
So there are a lot of PT schools in the country. It is somewhat competitive depending on the school. I would say in the state of Iowa, the University of Iowa is one of the most competitive because it's been around a long time. And it's pretty highly rated, so it's pretty competitive to get in. The problem is there's not a lot of slots available. So they accept about 40. I think they've increased it. I'd have to look. They might have increased it to 42 or 43 a year. And if you're having, how many applicants apply for 42 slots, it gets pretty competitive. But that's why you can apply to multiple schools. So, DMU here in town is an excellent school. I've had a lot of friends that have gone to DMU, St. Ambrose, and Clark, and then Iowa are the four major ones. I'm trying to think. I think there was another program that opened up here in Iowa some time ago. But, it is competitive, but you can spread out different areas that, if you apply to multiple schools, obviously it'll increase your chances of getting in. And, if you don't get in the first time, you can apply the next year too. So definitely competitive, but you can do it for sure.
And then is there continuing education required to keep your PT license?
Yes. So every 2 years, you have 40 hours that you have to complete of continuing ed. And it's usually very easy to get because most companies are consistently offering different classes or bringing people in. And that's a big part of the job itself. When you go to school, you get a good understanding of the basics, the anatomy, early level treatments, stuff like that. But when you really can grow your abilities going to, post education, continuing ed stuff. Like I've got my dry needle certification, I've gone to certain manual classes, and I feel like, you really can hone your skills with continuing ed. So yeah, every 2 years it's 40 hours.
Great. And then someone asked, how do you know if this is the job for you?
Oh yeah, that's a tough one. I think it's always hard to know until you kind of get into it a little bit. So I would say the biggest thing that you can do to know if it's for you is to attend something like this to kind of get an idea if this sounds like something for you. But then most PT places, and it's changed a little bit with COVID, but most PT places will allow observation hours, and schools will want you to have observation hours. So you can call a clinic or a PT place near you, and you can just ask, hey, do you guys offer observation hours for students? And that's a great way to shadow a PT, to have it, you could spend an hour or two or whatever with them to see, is this something that seems like, I would like to do?
Yeah, Dr. Mack, I had that on my list to ask you to talk about
Sure.
that. So thank you.
You bet.
I swear you're like reading my notes. I appreciate it. Well, I know you have an appointment at 1:30. So my last question for you is there any like last minute advice or one last sign off to the students listening about your career and what it means to you and just all of that advice?
Yeah, I think, I wanted to get the pre-PT one in, like the club or whatever was one that I really wanted to make sure to mention because I think that helped a lot. But just if it is something you want to do, get into looking into it early in college, because there are quite a few prerequisite courses that are required to apply for physical therapy school. And then you have to apply pretty early in your senior year of your last year at undergrad. So just make sure that you're prepping if it's something you're serious about doing. If you get that stuff done early, there is no headache. But if you don't, and you're running into those deadlines, because there are some, like, you have to write some essays and you got to apply and do a bunch of different stuff. So if it's something you're serious, join that pre-PT club, or if you're not willing to do that, just make sure you're doing some research and getting it going early.
Yeah, and like background checks that sometimes take,
Yes,
and sometimes you
exactly.
have to do like a health physical, and just
Yep.
lots of different items that aren't hard. They just take time. So
Yes. And you don't
yes,
want to miss that deadline.
absolutely.
Yep.
Well, Dr. Mack, thank you again so much for your time today.
You bet.
We've learned so much about physical therapy. We truly appreciate it. And for all of you who are on the call, thank you for tuning in. Everyone, have a great day.
Thank you. Bye, everybody.
Bye.